Okay, Dr. Carpenter's been talking about drugs to use for synchronization, manipulation of the reproductive cycle in order to get these cows bred. One of the things we really want to stress is according to the FDA or by FDA regulations, you can only use drugs that are approved for manipulation. In other words, drugs that are labeled to synchronize cattle. Now I know there's a ton of different formulas out there using this drug, that drug, but and all the drugs he's talked about are certainly labeled for that purpose. But Amduca, which allows the veterinarian to use drugs extra label and to write prescriptions to clients to use extra label, that's only for pain, suffering, in other words, pain, death, stuff like that. So you can't use those for production purposes. So you cannot use a drug to synchronize cattle extra label. In other words, if it's not labeled on that drug for extra synchronization, then you can't use that drug. So just want to make that point that the drugs he's talking about are certainly all labeled, but you want to be careful with some of the formulas that you find or people talk about. Some of those drugs are actually illegal to use now, but you can't use a drug extra label for this procedure. Does that make sense?
Yes. One other thing we want to say a little bit about, Dr. Hairgrove, is safety in handling prostaglandins.
Mm-hmm.
Want to address that? Or?
Okay, and prostaglandins can really cause some big issues. So again, I recommend wearing gloves when you're using prostaglandins. Especially people with respiratory problems, asthma, stuff like that, you can get bronchospasms. Pregnant people that are pregnant or in that stage of life where they're reproducing need to be very careful. Everybody needs to be careful with these drugs, but they can affect pregnancy. They can affect people with asthma, other kind of bronchial issues. So again, always wear gloves. Be very careful in injecting these things. Never inject it in yourself. Of course, I know that sounds stupid, but occasionally that'll happen. If that does happen, you need to probably talk to the doctor.
Yeah, I've even heard of people getting some of these products in their eyes, and that's a real easy way to absorb them. So be careful there.
Yeah.
And prostaglandins are also a script product, correct? They have
Well,
to get...
yeah, all these are script products. Yeah. So all these are script products, but just remember, read the directions, and it's on the directions. But in practice, I had a client that nearly died. He had asthma all of his life. But anyway, they were in a hurry, got a bunch. He just got it on his hands. Now he might have rubbed his eye. However, he absorbed enough that he was sure having some issues and wound up in the emergency room. So again, follow the directions and just be aware that you cannot use drugs extra label for this process. So if somebody comes and they've got some kind of wild concoction, if that drug's not labeled for use in this, well then actually it's illegal to use it that way.